Imagine you're talking to a loved one, and suddenly their face droops, their speech becomes slurred, and they can't lift one arm. Would you know what to do? A stroke is a medical emergency where every second counts. Acting quickly can save a life and reduce the risk of permanent disability. Today, let's learn how to recognize a stroke and respond fast. What is a stroke? A stroke happens when the blood supply to part of the brain is interrupted or reduced. Without oxygen and nutrients, brain cells begin to die within minutes. The brain controls everything we do: our speech, movement, memory, vision, and thinking, so a stroke can have serious consequences if not treated immediately. There are three main types of stroke. First is ischemic stroke, the most common, caused by a blood clot blocking an artery to the brain. Second is hemorrhagic stroke, caused by a blood vessel bursting and bleeding into the brain. Transient ischemic attack, or TIA, is often called a mini stroke. Its symptoms resolve quickly, but it's a warning sign of a future stroke. It still requires urgent medical assessment. Your risk of stroke increases if you have high blood pressure, diabetes, high cholesterol, atrial fibrillation, an irregular heartbeat, smoking, and obesity, excessive alcohol intake, physical inactivity, a family history of stroke, increasing age. The good news is that many of these risk factors can be managed. The easiest way to recognize a stroke is to remember the word FAST. F is for face. Ask the person to smile. Has one side of the face drooped? A is for arms. Can they rise both arms? Does one arm drift down or feel weak? S is for speech. Is their speech slurred, confused, or difficult to understand? T, time. If you notice any of these signs, call your local emergency medical services immediately. Do not wait to see if the symptoms improve. Other symptoms may include sudden loss of vision, severe dizziness, difficulty walking, numbness on one side of the body, or a sudden, severe headache. Why is a stroke so dangerous? A stroke can affect almost every part of a person's life. Possible complications include paralysis or weakness, difficulty speaking or understanding language, problems swallowing, vision problems, emotional changes such as depression, and long-term disability. The sooner treatment begins, the better the chance of recovery. How is a stroke diagnosed? In hospital, doctors may perform a neurological examination, a CT scan or MRI of the brain, blood tests, an ECG, and blood pressure assessment. Other investigations to determine the cause. Brain imaging helps determine the type of stroke, so the correct treatment can begin as quickly as possible. Treatment depends on the type of stroke. For an ischemic stroke, treatment may include medicines to dissolve or remove blood clots. Also, blood-thinning medicines and blood pressure management are used. For a hemorrhagic stroke, treatments include controlling the bleeding, blood pressure management, and sometimes some surgery. Rehabilitation with physiotherapists, occupational therapists, speech and language therapists, nurses, and doctors is often an important part of recovery. You can reduce your risk of stroke by keeping your blood pressure control, managing diabetes and cholesterol, and stopping smoking. Exercising regularly. Eating a healthy, balanced diet. Maintaining a healthy weight. Taking prescribed medications as directed. When should you seek emergency help for a stroke? If you or someone nearby suddenly develops facial drooping, arm weakness, slurred or confused speech, sudden vision loss, sudden severe dizziness, sudden numbness on one side, or a sudden severe headache unlike usual, seek help immediately. Call your local emergency medical services immediately. Do not drive yourself to hospital unless there is no safer alternative. Prompt treatment can make a major difference. A stroke is a medical emergency, but recognizing it quickly and acting fast can save brain function, reduce stability, and save lives. Remember the word FAST: face, arms, speech, time. You could make all the difference. If today's lesson helped you, share it with your family and friends. Knowing the signs of a stroke could one day help save someone's life. Tomorrow, we'll discuss heart attack, how to recognize the warning signs, what to do immediately, and how to reduce your risk. Follow Nurse IQ for trusted, evidence-based healthcare education that's easy to understand.